Hi, you guys. This is Dr. Tahir from Family Pediatrics, and thank you so much for joining us today. Today we have Andrea here today with the cute little baby Aubrey here today. Aubrey is 4-month-old and one of the cutest little babies we have here today. Now, we are going to talk about feeding for her because at 4 months of age, kids are usually okay to start eating some solids. And the way we tell if she's ready is if she's holding her head up fairly well. So when you look at Aubrey sitting, she's sitting with her head nice and straight, holding her head up. And when she lays down on her back and you pick her up from her arms, she keeps her head up. It doesn't fall back. So if a baby is not strong enough yet to keep their head up strong, then they're not ready to eat solids yet, okay? Because it becomes a choking hazard. So typically at 4 months of age, babies will do that. Some babies take a little longer. In her case, she's super strong already at 4 months of age, and she's looking good. Now, the first thing I want you to do when you start solids is to get some rice cereal, just from the baby food aisle, okay? You can get organic rice cereal too if you want. That's available from the local Woodman here if you want to get it from there. Or just any rice cereal is fine. And then you want to mix it with water or breast milk or formula. So it's not too thick and not too runny. Just like how we would eat oatmeal, for example.
Yeah.
And you use a couple teaspoons of that and mix it up. And then use a little baby spoon and feed her 3 times a day. Morning, lunch, and dinner time. All right. When you feed her, you want to have her sitting up or inclined a little bit. Car seat works fine, and also a bouncy chair works fine for that. So she'll be inclined up a little bit. Use a spoon and feed her with a baby spoon. When you first feed her, she won't know what to do with it. She'll spit it out with her tongue. It'll look like she doesn't like it, but it's only that she doesn't know how to eat it. Okay? You'll have to keep up with that for at least a few days, sometimes even a week, and you'll know eventually that she's starting to eat well because more of the cereal goes in than she spits out. So you'll know she's starting to eat well. After she starts eating well with the rice cereal, then you can have lots of fun giving her stage 1 baby foods, Stage 1 foods are basically fruits or vegetables, a single fruit or a vegetable, which is put in a blender and made into a paste. So you can buy the stage 1 foods or you can make your own if you want. The main trick is going to be to use only 1 food at a time for a few days to make sure that Aubrey doesn't have any reaction, she's not having any problems, and if she likes it or not. And after that, then you give her another food, and you can try all sorts of different things and have lots of fun and see what she likes and what she doesn't like. Now, if you find a food that she doesn't like, just don't use it for like a week or so. She'll have forgotten completely about it. And then try it again. It'll be a brand new food for her by then. So you can keep trying that. Some babies like certain foods and some babies just hate certain foods. Sounds good?
Yeah, that sounds great.
We're going to keep her on the stage 1 type foods, the pasty-like foods until about 6 months of age. And at that visit, when I see you, then we'll increase her foods and give her more texture at that time.
Great.
Sounds good?
Yeah, one question. So we would do the breakfast, lunch, and dinner. Would I breastfeed her first and then? And then see if she'll take
Go ahead and do that. Go ahead and breastfeed her first and then give her some solids. Either breast milk, if you're breastfeeding, or formula is still going to be your primary nutrition. And the solids are going to just start adding a little variety. And also when you start feeding her solids, it'll change her schedule quite a bit for breastfeeding and also for her pooping schedule. It's impossible to predict. You have to play it by ear a little bit. But you may notice some changes with her stool patterns and also with how often she wants to breastfeed or how much she wants to breastfeed.
Sounds good.
Excellent. Also, another side note is that breastfeeding just by itself is also perfectly fine too. Kids don't have to start eating solids if they're drinking breast milk. So some parents do elect not to start solids. Most do start some solids at this time, and it's okay. All right. Well, thank you so much for being our cute little model. She did a fabulous job, and thank you so much for coming in today and helping us with this.